I'm delighted to introduce Mary Sue and her panel of people, and she's going to talk about what's going on in Detroit. So Mary Sue, it's yours.
And we stand between you and lunch, so we'll be succinct. But we do have a lot to say. So I'm so glad to see everybody today. Again, I'm Mary Sue Schottenfels. I'm the Executive Director of ClearCorps Detroit, and we're going to tag team this a little bit so we can all tell you a little bit about what we do. Before we start, I have several partners in the room, and I know that some of them will present, others won't, but I just want to point out that I think we know this in all our cities, that we're only as strong as our partners. So I want to tell you a little bit about each one. Mary Morrow here is from the Wayne County Prosecutor's Office. You've met her a couple times. The Wayne County Prosecutor's Office will present tomorrow. I think it's tomorrow, your panel. But they do tremendous work, and they've really led the way in the state in terms of taking a state law called the Landlord Penalty Law and making sure it's actualized, at least in our county. And really, it's the only county where things are going strong. So I just want to acknowledge her as a partner, and I think we've put this issue on the map in Michigan because of Mary. And the next group is the group from MDCH, Michigan Department of Community Health, Wes Preem, Courtney, and Tom. And the state, as you know, can take a small role or a large role in this kind of work. Our state has really stepped up through their office, the Office of Healthy Homes, and really gone way beyond just having a HUD grant to trying to be innovative and create a lot of new ways of looking at the healthy homes issue. And I know they're not presenting at this conference, but they have done a tremendous job of leading the way with healthy homes, and they have a study that they've published that has to do with reducing asthma rates. And so I urge you to talk to them and learn more about their model, because they really have helped lead us to where we are today. And the third group are my buddies at Wayne State, and we really just couldn't do this work without them. Like and his team, Julia, Angie, and Lynn. Like is not only a mentor, I think, along with Wes to me, but has really created a vision for what you can do with data in healthy homes. And we've got a tremendous case management system and a lot of data analysis around lead, but now starting to look at healthy homes and doing a lot of surveying households on healthy homes and finding, stunning results, but doing enough data to help raise this in terms of a national issue. So I acknowledge you for doing that as well. So with that, Healthy Homes Detroit. So our organization is actually ClearCorps Detroit, and ClearCorps has been around since 1999, and we started, as many of us did, through community organizing. We were working in several neighborhoods in the city and talking about health organizing. How can you really organize around health? And looked at several health issues, access to care, believe it or not, tuberculosis, and lead surfaced from the community. And we realized that lead, this is the first time I had heard about lead, was a huge problem in the city. So we really came from the community organizing point of view as opposed to the health department point of view. So we started then, and we've grown quite a bit into a full-service lead and healthy homes organization. We have seven staff, and 2 AmeriCorps members, and an annual budget that goes from $500,000 up, depending on what grants we have. We have a 9-member executive board. One of the things I've been inspired hearing today is some of the boards you all have, Omaha, and how we should build that board and make it, much wider and have many more influential leaders on it. And we're affiliate of ClearCorps USA, which is a national organization, and as is Omaha. Also, in our city, we have the GHHI initiative, Green and Healthy Homes Initiative. You may be familiar with that. It's in 14 or so cities, and it's kind of another group that's coalescing folks around the issue of healthy housing. And in our city, the GHHI Collaborative serves as our collaborative for the ASHE grant. And that group has pretty much every kind of leader you can imagine, from the city, the state, nonprofits, hospitals, community organizations, universities. And together we're working to kind of, again, raise up that issue so that it really becomes on the radar screen of the city and the state. So Detroit. Well, you all know about Detroit. You read about Detroit. And I will say, like somebody else said, it is a tale of two cities, because yes, tremendous financial problems. Yes, we're about to face an emergency financial manager. Yes, we're in a tremendous amount of debt, but it's also an extremely resilient city. There are a tremendous number of community organizations, and there's a lot of effort to reinvest now by the corporate community. So there are core parts of the city, the downtown, and if anybody knows Detroit, kind of out woodward to the university area. There is an amazing amount of building and energy and new investment. So in some of the neighborhoods we work in are kind of along that corridor, but not quite in that area. So yeah, we have a lot of single-family homes. We don't have the situation that other cities have of apartment buildings, which would help for landlord settlements, EPA settlements. We've got a lot of small mom and pop operations, which make it difficult in terms of enforcement. Of course, the city has tremendous fiscal challenges. The lead incidence has gone way down. When I started, it was about 20% of the kids had lead at a level of 10. And now we're down to a level of 5, as you know, and the incidence is still, well, close to the same. Still about 3,000 kids a year, still way too many, and we're still only testing about 45% of the kids. So we're still in that. It's interesting because our stats have gone down, but then the level went down, so we're still in the same place that we were. And then the asthma prevalence, I think this number is low. This is the number I could collect, but we think that about really 20% of Detroit kids have asthma. So it's another huge problem. We're developing more asthma strategies all the time, and looking at that as one of the asthma triggers is one of the key issues we're working on in homes. Now, how have we been funded over the years? Well, we've had some HUD grants, and that's been great. We had, remember Operation LEAP? That was an old lead rubric a few years back, and we had one of those grants, Healthy Homes Production. And we work with Michigan Department of Community Health. They have a lead hazard control grant, and we manage that in the city of Detroit. We've had some EPA grants in the past. We need to get back to getting EPA funding, Kathy. Kresge Foundation, I can't say enough about Kresge. Kresge has had the foresight to fund us and many of you over the years, and it really is just such a leader on these kind of issues, and we appreciate that. We've had lots of other small grants. We've worked pretty well on corporate partnerships. So we'll talk more about the DTE partnership later because they've got some interesting programs that we're partnering on. We've got several sub-grants helping people do their work. And we have a website, and we have had 3 donations so far. We just put it up. So ClearCorps Detroit, you can click donate. Is this where you go? Okay. So we have really 4 or 5 programs. It looks so much like Kara's slide. It cracks me up, really. Healthy Homes Detroit, obviously, is our signature program right now. The Lead Safe Homes program, which is the HUD program to do actual full abatement in homes. Energy efficiency has really come on in terms of several initiatives that we'll tell you about. Education and training is always kind of our bread and butter, and we believe very strongly it's key. And then policy and advocacy. Healthy Homes Detroit, the discrete program that we're here to talk about, it started as a Kresge-Skillman pilot, and so Kresge and another foundation, Skillman, each gave us $70,000, and I was urged by to just get in there and do some work. I mean, it's not a lot of money, but take a small pilot, 20 houses, and anybody that's not quite there yet with doing the work, I urge you to just put both feet in and try it. We've got a lot of models to work from, and huge learning curve, but it certainly paid off because then it led to us getting a Healthy Homes Production grant. I don't think if we had had that experience with the first 20 houses, we could have gotten that Healthy Homes Production grant. We got some funding through the GHHI to add a few dollars to our repairs. And the GHHI also funded one of our partners to do a large training initiative around training and then placement in green jobs. And then, of course, we got the Kresge-ASHE grant. Just when it's not my turn anymore, tell me. So what do we do? I mean, what do we all do in this work? And we kind of just tried to quantify it a little bit. So it's safe and healthy. So in terms of safe, we're preventing fires. We've got several examples of where we've done that. Preventing CO poisonings, again, several concrete examples of where that's happened. Lots of falls, preventing lots of falls, lots of bad staircases, unbelievable numbers of bad stairs. A lot of electrical hazards. As you know, as you can imagine, the homes in Detroit are just deteriorating. And so we're doing a lot of, number one basic fixes. And then helping people save energy with insulating This is one of our staff putting up CO detector or smoke detector. In terms of healthy, I think we're helping to prevent lead poisoning through several of the grants we bring to families, not so much our grant, but the other partner grants. Helping people restore water, a big problem is just people don't have water. There's some pipe in their house broke and they no longer have water. I mean, we're talking about basic. And it really makes you feel good, as Rachel can tell you, when you get somebody's water turned on. We talked about it, I think it was right before Christmas, or right before some break, and she just felt so good. She left those people with water. Tons of mold and moisture, a lot of fixing small roof leaks. It's hard to raise enough money to do a whole roof. We've done a couple, but very expensive. Giving warmth. We've replaced several furnaces for people, again through partners, and that's why our partners are so key. But so many people in Detroit do not have working heat, and so we're really trying to confront that. And then we're working, I think, pretty well to reduce asthma symptoms and just all the things that go along with asthma symptoms.
Okay, so some of the goals for ClearCorps Detroit is to make 140 homes healthy and safe through education, repairs, and partner resources. Also, building community awareness and community will, making policy, advocacy, and enforcement improvements, and developing a replicable model. Next slide. So some of our production stats, so far 128 families have enrolled in our program. 124 homes have been assessed. 91 of those homes have been completed, including 73 homes for Kresge. Post-repair follow-up visits for 46 homes. We'll go to the next slide. Now, the picture that you see is the average size of a house that we work in. So our housing stock is huge. I think the square footage of the houses are probably 2,000 plus. So these are huge. Yes, so these are huge houses with lots of hazards. As you can see, 10,000 plus occupied housing units in our target area. 73% of those were built before 1950. These are houses in our historic district. 75 of the houses in our program are owner-occupied, and 23% of the families report children living there with asthma, also visiting children. They also have children under 6 in the homes. There are a lot of community groups that are active, and also the residents are very active, and over 80% of the clients' homes are behind in property taxes. Property taxes is one of the biggest barriers for our clients, and because of the property taxes being delinquent, homes going foreclosure, or they're not able to apply for our partner services provided. So in recruiting, through recruitment, we do a lot of education and outreach. Word of mouth is a big way we get our clients coming in. Once we qualify the family, low-income families, of course, we assess the homes, and after we prioritize, the hazards, we create a family action plan. The family action plan is a plan for the family to take steps to make their homes healthier and safer. And we also have actions that we come up with to help aid the family in doing so. For Tier 1, we educate our families. We believe that educating the families on how to maintain the different products that are given to them, or educating them on what the hazards are and how they are creating issues in the home is very important. And health and safety and green products are given to the families. In Tier 2, repairs to address the hazards are discussed. And in Tier 3, referrals to our partnering agencies happen. So here we have Rachel. She's installing roach baits. So we don't only tell our clients what they can do with those roach baits. We'll get right in there and say hello to the roaches. We also have a lot of integrated pest management. And we have an AmeriCorps member here who's installing the smoke alarm. There's also, and I can barely see, over in the, I believe it's your right, We have one of our AmeriCorps members who's no longer with us, but he is with a client. And we believe that building those relationships with the clients is very important. So we do assist our clients in through case management. So our Healthy Homes Tier 2 repairs, we're able to replace, repair, and improve, for instance, 68 gutters and tubs and roofs. These are minor repairs to the roofs, just to mention. Also, we install railings and stairs for porches. We also had 12 furnace or boiler repairs, 33 electrical repairs, 11 homes received asbestos removal, and 54 of the houses received basic weatherization. This includes air sealing, things like that, door sweeps. So it's not your big weatherization program. Again, also integrated pest management, 11 homes received that service. And as Mary Sue mentioned earlier, our partners are key for the weatherization program. We've had 19 apply for the DOE weatherization program, 25 through Better Buildings, and 37 through DTE. And I believe that Mary Sue is going to talk about that in depth a little later. This includes DTE, test and tune up completed, and also 7 furnaces were replaced. And the furnaces in the average Detroit house is about $7,000. So okay. Another partner is Citizens Bank. We've had 4 of our houses receive roof repairs or exterior repairs. And when Citizens Bank give money to a house, we're able to match. We've also had 3 homes receive CDBG repairs. For the lead remediation program, we've had 11 completed or in process. And for the asthma program, we were able to have 20 families educated through the Asthma Allergy Foundation of America. And I believe it's you.
All right, so just wanted to tell you a little bit about sort of our production assessment process. Because we do have a HUD grant, the Healthy Homes Production Grant, so we do look for many, many hazards. If some of you are maybe familiar, we have 29 hazards we're mandated to look for, so this gives you a sense of all of these things, and it's pretty broad, and it changes things because you're looking for a lot when you're in one home. I just want to show it to you. This is a whole nother presentation, but many folks might have heard of the Healthy Homes rating system, and you might have heard a variety of things about it. I actually think it's has been useful for us. But this is a tool that is mandated by HUD if you have a Healthy Homes Production Grant, and it's really a risk assessment tool. This is not an inspection tool. It does not tell you how to do an inspection, but it's a risk assessment. And what it's really designed to do is to compare very different hazards, which can be very hard when you go into a home and you have, here's 3 dramatically different hazards in a home. These are all owner-occupied, low-income homes, so you can't really do, rental advocacy, but we need to find out what's the biggest hazard to address. So how do you compare an unlikely hazard that if it happens, we'll use the asbestos, a very unlikely, but if it happens, the outcome's pretty serious, to a much more likely hazard, but the outcome isn't doesn't have as big of effect, or something that might be slow, affects you over time, like this mold in this corner versus this missing porch, which when it affects you, it's kind of an instant effect. So how do you compare 3 things that are so different and decide which is the biggest health hazard? So it compares these using a formula to really focus on what's the biggest health effect, to really say, with limited repair dollars, how do you focus your efforts? So that's a little bit about the HHRS, a little bit about sort of our Healthy Homes experience. In addition to our production, we are working with Wayne State, along with several other partners here, on a Healthy Homes Tech Studies grant to really look at the HHRS as a tool, and so we're conducting HHRS assessments across Detroit as part of this HUD-funded evaluation. We also, in addition to our model, try and work with other organizations. Southwest Detroit Environmental Visions was developing a Healthy Homes program, so we were working, actually Joanna was working with the program coordinator there to really show her how to do assessments, help her sort of strategize with families, and so that was really helpful. And then sites who are across the country have sort of called us or asked us to send us some of their documentations for implementing the HHRS. So we've got to unofficially sort of give advice to folks in Vermont or all across, I think Newark, yeah, we did send you a few documents. Hopefully they're helpful. And then Courtney and I like to team up, and I've helped her with 2 HHRS trainings. So we try and help. We think we have some good advice to share, so we try and share it when we can.
So basically, a quick slide just to say that, we know education and outreach is so important. And so beyond doing the obvious community presentations and our Elmo, that's our Elmo. Somebody on our staff dresses up as Elmo. And as you heard the other night, we march the kids around with signs, and it's just it's very popular. We also help sponsor our RP trainings. We've done one last year and one this year, and we really try to focus that on getting people that we're working with to come and learn how to work lead safe. But we also get plenty of contractors and folks from other agencies who, it's kind of almost like a lead 101 now, since there's not really lead safe work practice training. We help some of our partners and some of our contractors get into the free trainings that we know about in terms of the more lead supervisor, more professional training. And then we train ourselves as much as possible, and we've been trained in asthma management, asbestos awareness, bed bug prevention, a big issue in Detroit, and the Healthy Homes rating system. This is one of, I think, our newest and most important initiatives, and this is to look, and I salute Kresge for having the foresight to say, get beyond doing the work in houses and get to looking at some of those bigger picture issues, kind of forcing us to think more critically about that. So the enforcement work group, which Mary helps staff, really does work in several ways to assure that rental property owners are making their properties lead safe, because really, face it, we're not going to be able to solve this problem by HUD funding. I mean, we'd like to think we will, but we won't. The only way to make a rental property safe is to make the people that own it make it lead safe. So we have a lot of energy in the city for this initiative. And we'll talk more about this in one of the other workshops, but basically there are 3 mechanisms: the Detroit Property Maintenance Code, and we now have a lead amendment, kind of like the nuisance amendment, I would think, where every rental property owner has to make their home lead safe before they rent it out. Now, do they? But we're working on it. And so we've got it on the books now. It's been around for about, I think, 2-3 years. And we're both educating rental property owners about it and also working with our building department to get them to enforce. And I think the intent is there on everybody's part, but it's difficult with the resources. Michigan Landlord Penalty Law, you'll hear lots more about it tomorrow. And we all know about the federal disclosure rules. So from time to time, we talk to HUD about, and EPA about, come into our city and help enforce, but it's difficult because we don't have large properties. And so you'll hear more about this tomorrow, but the bottom line is we have to work to keep the pipeline full so that we're feeding properties into the enforcement system, and Mary and I are working closely to make sure with limited resources in Detroit we keep that pipeline full. Breaking the cycle work group. This is now Rachel's baby.
This one is very near and dear to my heart. Part of it, through doing the production and working with families, we started to see a lot of barriers that were keeping families from getting services. Some of them, a few of them, I think that are especially common in Detroit. For example, Joanna mentioned property taxes. With 80% of the families we worked with who are owner-occupied, we're at least one payment behind in their taxes, which means, well, the lead grant existed and this family desperately needed it, they couldn't get the resources. Also, utility shutoffs. You can't get repairs if your utilities have been cut off. And in Detroit, because gas and electric are owned by the same company, when you're shut off for everything. So it's not other places. If you're shut off for heat, we're in Michigan. It's a big deal to get shut off for heat. You can use space heaters. If you have your electric, you can't. You have no gas, no electric. I don't even know how. How families live is amazing. Sometimes, families are resourceful, but you have no gas, no electricity. So utility shutoffs are a major thing, not just for getting resources for our program, but a major public health issue as well. Also, one of the things we have in Detroit, due to our housing market, for the first time ever, families are able to buy a home. So for $5,000, they can buy a home. However, this home might not have working heat. And by non-working heat, I don't just mean the boiler might be missing and the radiators, or that's where the 7,000 number comes from, because the furnace isn't ducted right. So it's not just that you need a new furnace, you need to reduct it. The roof, problems with the roof, major lead hazards. And then also, buying a house for the first time, the person selling it to you, you're not going through a HUD-approved housing counseling agency. The person selling it to you said, don't worry about that $10,000 tax debt, that's reset. Well, if it's not in writing, that means nothing. So you now have a house with a huge debt to fix up, and you owe $10,000 in taxes, so you can't get any help. So these were issues we were coming again and again, also because of the historic area. Families are finally able to buy houses, but these are some of the conditions. So we wanted to, these are the things we were doing, and thanks to Kresge, we were able to pull folks together to address this. So we have several things in our Breaking the Cycle work group. I'm going to talk about buyer beware to address that issue. We're trying to bring a service providers forum because we found there are a lot of resources, but they're so complicated, they're so nuanced, and so just giving families a list of 10 resources, 6 of that they might be eligible for, but probably not, 1 maybe, and so really helping service providers and community organizations understand this web so that they can really help families and work families through this process. Developing a resource binder so that our partners can really navigate this system, and then some education on how to reduce property taxes, because until we address that, we're not going to be able to address some of the other issues. So this is just our flyer. There actually is, in Michigan, all cities have to have a program for low-income folks to reduce their taxes, or to get reduced or no property taxes. They do not, however, have to publicize this at all. So our goal, we've worked with families, or one of our legal aid partners works with a family who was losing their house due to property tax foreclosure. This family was probably eligible for this 3 years ago, and if they had gotten this, they wouldn't be losing their home now. Or our families that have $6,000 in debt, if they can not pay any more taxes, they can catch up slowly over time. So we really tried to get this out there. It's a complicated program. There's more information in your binder, our flyer. And then also, buyer beware. Really focus on those homes, families who are buying as-is homes before they buy them. Let them know what they're getting into, what are the key signs of a scam. These are all legal scams, too. I would call them unethical, but they're still legal. So how families recognize them and try and reach the families who aren't using the housing counseling services. So we're working on this right now. Signs of a scam, sort of some tips for buying homes. What are the key questions to ask? What are the major warning signs? And the different types of purchasing. We have land contract, which is like you own it, but you don't, and it's so we want to really let families know what they're going into and what are some potential problems with transferring ownership at the end. And then what's neat is because we're bringing together a lot of community organizations, a lot of service providers, legal aid, there's some initiatives, because these are folks working every day with families. So some of the additional advocacy policy stuff emerges from the committee, and there's one of the community members on our committee is starting to work on some other things, and so we might see how can we support her and support her organization with that effort.
The enforcement and the advocacy, which are new to us, have really, I think, mobilized our interest and the interest of our community partners. I think we're making great strides with both of these. In terms of policy initiatives, we also have those. The first one is and somebody here is going to talk about trying to get HMOs or health plans to help pay for our services, which they do in name, but they don't really do it in spirit. So in Michigan, there's a program called the MATCH program, which actually in a couple parts of Michigan, not Detroit, actually pretty much funds asthma home visiting programs. So we're going to try to get that into Detroit, and at minimum, we're going to start doing more focused asthma work in our units. Also, we've got a group called the Michigan Alliance for Lead-Safe Housing, and the state helps lead that. We are really working very diligently to get a dedicated funding stream for lead into the state budget. It's high time we do it. The lead program in the state is fully grant funded, and we know what that can do. Historically, the state has funded lead, but they don't anymore, and of course then CDC funds are no longer there. So we're really, we did a bunch of education visits in Lansing last week, and last year the Senate and House put $2 million in the budget for lead, and the governor vetoed it. So we're back at the table doing that, and that would be a major policy change. If we can get a dedicated source of funding in the budget for lead abatement in particular, that would be tremendous. And then the third thing we're doing is this kind of a smaller project, but making sure all the partners we work with have basic things in their housing specs that include smoke detectors, CO detectors, and fire extinguishers. And numerous stories of CO, like CO going off, CO detectors going off, people using their fire extinguishers to put out fires. And I would wager that our stats match Omaha's in terms of people that don't have these in houses. Very few people have them, and if they do, they're not working. So those are our policy initiatives. Now Rachel's gonna, I know we're running short, but this is the most important part of our presentation. I think it's 3 quick case studies. They'll show you what the houses look like, what the family looks like, and what we're doing to do an intervention. And that's kind of close to the end.
Yep, we promise. And this, we tried to get a range of houses where we've got lots of partner work to ones where we're facing lots of barriers. So this is one home, pregnant female, now small infant, and visiting children under 6. All 3 are homeowners that we're looking at, multiple people with allergies. There was a program, a bank actually was able to match funding for exterior repairs in part of our neighborhood as long as they had homeowners insurance and property taxes current. So we had 4 families eligible, so we were able to get at least those 4 families. So it significantly increased the repair. We were able to replace 3 sides of the roof were in bad shape. So we were able to do that. You can see our front stairway repairs. There are 2 senior citizens who live there, so the front stairway repairs will make a big difference and replace windows for windows in really poor condition. We have donated smoke and CO detectors, and then we're able to do put those in and fix some stairway railings. Okay, Children's Hospital, yeah, they give us all our smoke and CO detectors. They have a program. It works really well actually for them too, because they install smoke detectors wherever they can, but they have limited staff. So the fact that they've trained us and we can put more in is good for them, and it's obviously good for us because we don't have to pay for smoke or CO detectors. This house, we were able to get into the MDCH lead program, and that actually I think just finished probably about a week or 2 ago. So the house now with a small infant is lead safe, and we're hoping they'll get approved for weatherization. They applied, we fixed the roof, so we're hoping. We have struggles, many families are denied for weatherization, but hopefully this will allow them to get the weatherization services. We went over our budget. We probably spent over $5,000 on this house, but we got a lot in return.
What was the property value, do you know?
It's close, yeah, it might be under. I mean, it may be under what we spent, but there's still a family living here. Right. Here's our second house, and this one actually, Julie and I met this house. She was filmed for a documentary. Her family was one of the first African-American families to move onto this street. Her mom lives down the street. Her uncle used to live on the street. Huge history and knowledge just in of the street with this family. But she had, visiting children under 6, also a child with asthma, several of the different hazards. And we did some smaller, about $3,000 of repairs, window replacements for bathroom and kitchen, so for ventilation, some bathtub repairs. We talk about cleanable surfaces and keeping houses clean, but it's hard to keep that kitchen clean. So, we did some flooring replacements, so for cleanable surfaces. And then when DTE, it's gone now, they ran out of funding, but they had a program where they were able to do furnace tune-ups, and they found really high levels of CO due to the furnace. So they were actually able to replace her furnace with a 95% efficient furnace. So that'll huge savings for this family. And then this one, oops, I'm gonna go back. This is one, I keep pushing it. I'm supposed to let Mary Sue do that. So this is one actually, we did one to show some of the barriers we face. This is a family, actually, Joanna talked about the 2,500 square foot house. This is a family of 10, so it's, grandchildren, her uncle, she's also taking care of her uncle, probably her mother, so it's a wide extended family. So they bought a family of 10, 2,500 square foot house is actually perfect for a family of 10. So, they have, the space they never dreamed they'd have in this house. But they do have a history of lead poisoning in the house, so they care very much about this issue. But they purchased actually the house. There was no heat and water when they purchased it, and it had $6,000 in tax debt. It's also on land contract, so the ownership is still a little unclear. The homeowner did a lot of work onto this home. We made sure they got lead-safe work practices training because they were doing the work whether we gave them the training or not. So their family removed the mold, and there was a lot of it, and restored water into the home. So they did the plumbing, they did the mold removal. We helped very small furnace repair, and then rebuilding the staircase. That's their stairs to their basement. That is the same staircase, and some areas that had no floors. So we were able to do some minor repairs. This house needs a lead grant. It's too big for it needs a lead grant. There are lead grants through the city of Detroit, but with her tax debt, they just can't get a lead grant. And it's really important to her. You can get property tax assistance if you're in tax foreclosure, but she was only 2 years behind, so they said, if you come back next year, you should be able to get this. But then, by then, the amount she's gonna owe is gonna be too much, so she'll exceed their limits, so she still won't be able to get services. So this is one where there's so much more we could do, but there's just, the resources aren't there. We're trying to help her reduce her current debt, so then at least she can start to pay back, so that she doesn't lose this home. Then, if she doesn't pay back, besides not getting a lead grant, she's put her life and her life's effort into this home. So we're trying to work with her to at least reduce her debt and see what programs she can be eligible for. So that's sort of another case to show you the wide range of houses we work with.
In 4 homes, we've had a CO problem when we've walked in one way or another, or somebody's called us and said, this thing is buzzing, what should I do? A long story, which I won't tell you, but the bottom line is there was a fire because we had lots of people in the neighborhood that we had helped, lots of smoke detectors. Smoke detectors went off, people had fire extinguishers, they all rushed to the house and they saved that house. So that was definitely because we were in that neighborhood and also had helped a bunch of people kind of in a constellation. This furnace problem is amazing to me, all these people with cracked heat exchangers, and that's a very dangerous situation. And we've helped families get into the weatherization program. So a lot of what we're doing is layering, helping people layer services. What are our barriers? Well, I think you've heard them, but roof repairs is a huge barrier. There's no good funding for roof repairs, and so many roofs need help in Detroit. Unpaid property taxes. I think our last survey again said 80% of our folks are in arrears in their property taxes. Lots of utility shutoffs. Enforcement issues, I think we're working on it, but again, we need more resources to do as good of a job as we can on those. Lots of families, as you just heard that story, fall through the cracks, and it's so frustrating to have one of our case managers working with a family, and we just cannot help them. We cannot figure a way to get them through the system. And Rachel talks a lot about the disconnect between policy creation and the day-to-day reality for people. So I think we're doing a good job of bridging that gap, but it is still there. What are the things we think are the strengths of our program? I think, again, partners, partners, partners. It's all about the partners. We've got some flexibility. The Healthy Homes Production Grant has more flexibility in it, and that's been nice in the Kresge dollars, so we can be creative. Very, very active community participation on these 2 new work groups. And we're just coordinating a wide variety of resources. I think case management, and whatever we call it in each city, is crucial to making this happen. I know for us, we can't just be an agency that gives people a few applications and hopes they figure it out. We walk people through every application. We sit with them, we nag them, until we get them through the process. And unfortunately, we don't have one touch. We should. So people are filling out 3 and 4 applications, and we're kind of with them every step of the way. So this is one of our families, a 3-generation family. We helped them get several grants, and they had a lot of lead problems, right, this family, and we helped them get a grant to fix the lead, among other things. So that's us. Thanks for listening.